This is a very common entity, and also common on the exam is airway foreign bodies. Particularly under 3 to 4 years of age, that's when you're going to see most foreign body aspirations. There's a reason why we say not to feed babies smooth things before a certain age. The peanut is the most commonly aspirated foreign body. The hot dog and bread are the most common cause of death from aspirating foreign bodies. We recommend that under the age of 5, you not give them peanuts or hot dogs or grapes or M&Ms, things that are smooth. Everything should be rough textured, chopped up so the child doesn't choke. When it comes to a foreign body aspiration, many times it's a witnessed event. So the child may be at a party, pops a peanut in his mouth or some kind of candy, something like that, and you'll see acute onset of choking, gagging, coughing. You may hear some wheezing, you may hear some decreased breath sounds. I took care of a child once who was 1 year of age and apparently had a life-threatening event or a near-miss sudden infant death. Kind of old for a 1-year-old, but they turned cyanotic and blew on him. Further questioning revealed that the child had been fed some popcorn by the babysitter, and on physical exam there were decreased breath sounds on the one side. Well, the child was taken to bronchoscopy and the kernel of popcorn was taken out and the baby was cured. So look for some of these findings. When you have a patient that you suspect has foreign body aspiration, the first test that you're going to get is going to be an X-ray. The location of the foreign body depends on the size of the foreign body and the size of the child because of the size of the airway. So many of them may be stuck up high in the larynx. Some of them can be in the trachea. If they go any further, they more commonly end up in the right mainstem bronchus because the right mainstem bronchus does not have such an acute angle off the trachea. And the right mainstem bronchus tends to be a little bit larger, so it's easier for things to slide in there. If you do hear wheezing and you suspect the foreign body, do not give them bronchodilators because that can make things worse. So your first test is going to be a chest X-ray. You can see air trapping, hyperinflation. The first thing you're going to do when you're listening to the child is the first test is going to be an X-ray, and you can see air trapping on the X-ray. If the child cooperates, you might be able to get inspiratory expiratory films, and you'll really see X-ray air trapping. And if the child really cooperates, you can get decubitus films, inspiratory and expiratory. Now remember your laws of gravity. When you're laying down, things should come down that way. If you have air trapping, you have the patient lie down on the suspected side, you get your X-ray, and on expiration, the mediastinum does not shift downwards because of the air trapping. The definitive diagnosis, so the best test, is going to be bronchoscopy, and that's how you remove the foreign object. Remember, sometimes they can have wheezing. Do not give them bronchodilators because when you dilate them, the foreign object can go further down. So here we have some X-rays. Here we have inspiratory expiratory films. You can see along here that there's nothing dramatic, but when the baby on expiratory, there's air trapping, and look at the size of that lung, because air is being trapped and can't get out, and that's why you have this. If you were to put the baby on its side, then you would see that the air trapping would prevent the mediastinum from coming down, and so it would stay up higher. This is a foreign body. I think it's a carrot. Okay? And this is a foreign body, but it's not been aspirated. This foreign body has been ingested. This is a coin, and the coin is the most commonly ingested foreign body. It's just stuck in the esophagus somewhere. And the reason I can tell you that it's in the esophagus just by looking at it is the way it is situated. If it's looking at you like that, that's called en face, for those of you who speak French. Okay? That's en face, meaning it's looking right at you. That means it's in the esophagus because of the anatomy of the upper airway. If it was in the airway, remember the anatomy of the upper airway, you have the cricoid cartilage, those rings are not fully closed all the way around. It's only like the 3/4 of the way around. And so the coin would accommodate itself in this direction rather than in this direction. If I see it like that en face, it tells me it's in the esophagus. That still needs to, and if it doesn't go down, it needs to come back out. You better call somebody to help you get it out.